Hello, welcome back to Simply Women's Health with CJ. In recognition of Cervical Health Awareness Month, today we're going to focus on the cervical cancer screening guidelines. So back in the day, we used to pap every woman every year. Once you became sexually active, you had to have a pap smear in order to even get your birth control. In 2007, a set of guidelines were created by an organization called the American Society for Colposcopy and Cervical Pathology, also known as the ASCCP. These guidelines have been adopted by both the American College of Obstetrics and Gynecologists as well as the Joint Task Force on Health Promotion. So they are pretty widely used. We do not pap anybody before the age of 21. Now, a lot of my patients come in and they insist that they had a pap smear done when they were in the emergency room. You get a pap smear by using a speculum. A speculum exam is not always a pap smear. Sometimes they use speculums in order to rule out infection, and that's typically what's done in the emergency room. They are not going to screen you for cervical cancer in the emergency room or in an urgent care center. So you get a pap smear every 3 years between the ages of 21 and 29. If you have atypical cells, your pathologist will probably do a reflex and look for the presence of human papillomavirus. HPV is a sexually transmitted infection. It is what causes 99% of cervical cancers. If your pap smear comes back with either low-grade or high-grade cells, they do not do an HPV reflex because it is assumed that you do have HPV. After the age of 30, you get a pap smear every 5 years if it includes what's called an HPV co-test. You can still get paps every 3 years with just reflex if abnormal cells are found, or you can get a pap smear and your provider can order an HPV co-test where we DNA test the sample for HPV. If both of those are negative, you get a pap every 5 years. Why 5? HPV is actually a very slow-growing virus. From the time it is discovered until it turns into cervical cancer is typically 8 to 10 years. So most providers are very comfortable with you going 5 years between screening paps. When do you stop getting pap smears? At the age of 65. As long as you have had 2 negative HPV co-tests within the last 10 years, or 3 negative pap screenings within the last 10 years. You do not need paps after the age of 65. If you have had a hysterectomy and you have never had any high-grade precancerous or cancerous cells, you no longer need a pap smear. That is, if they remove your cervix. If they did a hysterectomy and left your cervix behind, you still have to do the same guidelines as everybody else. If you have a history of precancerous or cancerous cells on your cervix, you are going to need to have pap smears every 5 years until it has been 20 years since you were treated or had the surgery to remove those cells. If you are living with HIV, your screening guidelines are just slightly different. You will typically get a pap smear at the time of your diagnosis, and then if that pap is normal, they will repeat the pap again in a year. Your pap screening is going to be every 3 years, and that should include an HPV co-test. Again, when you have HIV, your immune system is a little bit weaker, and you are more at risk for that HPV to turn into cancer. When can you stop having pap screenings when you're living with HIV? Typically, we recommend that as long as your viral load is healthy, as long as you are at low risk to be exposed to HPV, you and your provider can decide when is an appropriate time for you to discontinue screening exams. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.